Good afternoon. My name is Katie Metz. I'm with the National Disability Institute, and I want to thank each of you for joining us today. We are going to discuss the ABCs of the ACA, Introduction to the Affordable Care Act. Our webinar today is sponsored by Walmart, and once again, we thank you all for joining us. With that, I'm going to turn it over to my colleague, Nakia Matthews, who will go over a few housekeeping tips. Thanks so much. Nakia?
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see an image of here below. And if you accidentally close this panel, or if your sound stops or becomes unintelligible, you can reopen the audio broadcast panel by going to the top menu, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial one of the numbers you see here and enter the meeting code. You do not need to enter an attendee ID, and I will also paste this into the chat box. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you'd like to make this larger, you can minimize some of the other panels like Chat, Q&A, Participants. And conversely, if you do not need the media viewer, do not need the captions, you can minimize it. There will be a question and answer portion at the end of the webinar today. Please use the chat box or the Q&A box to send any questions that you have during the webinar to Katie Metz, and we will direct those questions accordingly during the Q&A portion. And you can also send them to me, Nakia Matthews. If you are listening by phone and not logged into the web portion, you can also ask questions by emailing them directly to Katie at kmetz, M-E-T-Z, at ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the NDI website at the URL you see below. If you experience any technical difficulties during the webinar, please use the chat box to send me, Nakia Matthews, a message, or you may also email me at nmatthews@ndi-inc.org.
Thank you, Nakia. Once again, my name is Katie Metz. I'm the Manager of Financial Empowerment Inclusion with National Disability Institute, and we welcome you all today. We want to give special thanks to the sponsors of National Disability Institute, and we'd like to give a special thank you to our sponsor of today's webinar, the Walmart Foundation. If you're not familiar with National Disability Institute, we are a research and development organization with the mission to promote income preservation and asset development for individuals with disabilities in order to build a better economic future for Americans with disabilities. We would like to envision a world where people with disabilities have equal opportunity to achieve financial stability and independence as people without disabilities. Within National Disability Institute, we have several programs. One of those is the NDI's Real Economic Impact Tour, which falls under 6 of our major focus areas: financial education, tax preparation, benefits planning, employment, asset building, and public policy. We have a variety of projects and initiatives funded by both private and public resources, where we are but we're most recognized for harnessing the power of collaboration with government, financial institutions, the business community, nonprofits, and institutions of higher education, all to advance new opportunities for employment and asset building for people with disabilities. We do that in a variety of ways. Throughout our network, we have an alliance of organizations and individuals that we work with dedicated to advancing the same economic advancement and empowerment of individuals with disabilities through over 900 partners in more than 100 cities across the United States. With that, I would like to turn it over to our presenter, Tara Straw. Tara is the Senior Policy Analyst in the Health Policy Department of the Center on Budget and Policy Priorities. In this role, she works very closely to on issues related to implementation of the Affordable Care Act. And before joining the center, she was the Legislative and Policy Director for Healthcare for America Now, where she led a broad coalition of advocates working on passage and implementation of the healthcare law. We welcome you, Tara, and we thank you for being with us today. Tara?
Can you hear me?
Yep, we can hear you.
All right.
Thank you.
Great. Thank you very much. I'm really happy to be talking to you. And for me, my professional background is in healthcare, but I also am the manager of a VITA site, a free tax prep site in Washington, D.C. And so for me, a lot of the Affordable Care Act implementation items really are the combining of two very different worlds into one. And so I'm really happy to talk to you, not just as someone who's been working on the ACA, but as someone who's actually a practitioner of sorts, a volunteer practitioner at least, in tax, which I know that many of you do. So I'm really happy to talk to you about the Affordable Care Act. It's in the news as much as ever, and I'm looking forward to getting your questions and leaving lots of time to answer them. It goes without saying, I think, for the population of people with disabilities, but other folks as well, that gaps in coverage can be devastating for people, because first, they're not getting the medical care they need, which could lead to worsening of their condition or greater financial costs later. But they can also be, gaps in coverage can be devastating financially for other reasons too. It's one of the, medical care is one of the leading causes of bankruptcy, and can certainly put people in a precarious position in paying the rest of their needed expenses. And so that is really the impetus behind the Affordable Care Act and getting more people in coverage. So first, we're going to look at some of the major aspects of the Affordable Care Act, and some of this may be very old news to you, so that's why I'm looking forward to taking your questions. And then we'll talk a little bit about how the premium tax credits work, because that's the major intersection with the tax world, and some of the consequences for failure to have insurance. So first of all, there are basically four major components of the Affordable Care Act coverage provisions. First, there are insurance reforms that will allow everyone to purchase coverage, and so this is the end to pre-existing condition exclusions and other things. But also what comes with that is an individual mandate to have coverage, and so beginning January 1st, 2014, everyone is required to have coverage unless you meet certain exceptions. To help facilitate this, there is the creation of these new health insurance marketplaces to make the buying of insurance easier. Some people right now are not having an easy time with the technology, but certainly our hopes are that will be worked out. Websites, I think, are fairly easy to get in line. It's easier to get the website in line than to rework the policy. So I think that will improve very quickly for folks. And then, of course, the major component is that there's assistance to make insurance more affordable. So many people who wanted insurance were still uninsured because they simply couldn't afford it. And this is done in two ways, through the Medicaid expansion and through premium tax credits for low and middle income families. So a little bit about the insurance reforms. Insurance companies will be required to sell insurance to everyone, and that means, particularly for people with disabilities, that they can't be denied based on a disability status, based on a health condition or a medical history, and they also can't be charged more based on those things. The only things that that can affect your premium are age, family size, and tobacco use, and actually geography, which is not on the slide. So where you live matters. There are also no annual or lifetime limits on coverage. So many people who have high health care needs would meet either their annual or lifetime limit and then would find themselves without any coverage effectively. There are also going to be limits on out-of-pocket costs, and so people won't need to worry about having costs that are unaffordable throughout the year. One other important element is that young adults can stay on their parents' health plans until age 26. And this has been around for several years, and it's been really effective in keeping people insured, keeping young adults insured during a time of transition for many people where they're going from high school or college into the workforce and maybe having a little bit of trouble with that transition. It's also important, I think, in many cases for people with disabilities because it's just another extension of insurance that people have had. And people like having consistency in their insurance and being able to stay on a plan. And so certainly if a child has a disability and is not immediately joining the workforce or is joining the workforce in a low wage or low hour position, then staying on their parent's health plan might be the best and most economical way to get insurance. And all insurance will have to meet certain essential health benefits, all insurance in the individual and small group markets. And that is 10 categories of coverage, broadly defined, that will make sure that important rehabilitative and habilitative services in particular are not excluded by insurance companies. But what goes along with these insurance reforms is a mandate to make them work. And so what insurance companies have said and what the economics of insurance proves out is that if you are opening up insurance for people to jump in at any time, then people could theoretically buy it only when they need it and then drop it when they don't. And that would lead to a healthcare system and an insurance market where the only people who have insurance are those who are using a lot of services right now. And that is sort of the opposite of what we want. So what we want is a system that spreads risk, where you have some people who might be using a lot of services right now, but a lot of people who are not. And the people, any individual might be in one group or another depending on the month or the year, but we want to make sure that everyone's in the same pool. So there's a requirement that individuals have to have health insurance coverage or they'll have to pay a penalty. And the requirement is not terribly strict. So most existing coverage is going to satisfy the mandate. So it's not a case where you're going to have coverage and then find out that it doesn't meet the requirements. That's not the intent. It's to make sure really that everybody has something. And there are exemptions provided to a lot of groups, including to people who have trouble affording coverage. And so we'll talk a little bit more about that later. And the penalty is assessed as a tax. So if you come at this from the perspective of a tax preparer, the penalty is something that you would need to explain to clients and possibly help them self-assess in, it would be in early 2015. So the penalty starts January 1st, 2014. It's for the 2014 tax year, and so you'd be reconciling that in early 2015. But there's significant help available to help people meet the insurance requirement. So first of all, there's a Medicaid expansion for individuals who have income up to 133% of poverty. And healthcare people talk a lot about percentage of poverty instead of straight dollar terms. So I apologize for that. But and states can decide whether they'll expand coverage or not, and about half the states have expanded and half have not. And there are anticipated to be 13 million newly eligible enrollees by 2023. So it's a huge portion of the people who are expected to be covered under the law. Other people may be eligible for a premium tax credit. That's available to people with income between 100 and 400% of the poverty level. It's available in every state. It's not up to the state to decide whether or not they'll take it. And 19 million people estimated will use the APTC, that's Advanced Premium Tax Credit, by 2023. And the reason it's going to be so important, it's so valuable to families, and it's so important that you're here and listening to this is because the average exchange subsidy is going to be $7,900 by 2023. So it's a very rich credit. And it's important that if people are eligible for it, that they know it and that they can claim it. And it's also important that people understand the rules of claiming it, so they make sure that they don't owe any portion of that back. So a brief look at the timeline. You can see that the open enrollment began in October 1st, for coverage that begins January 1st. And this year there is a special long open enrollment period. So open enrollment is going to be a 6-month period that ends March 31st. So this year and this year only, it's going to coincide with the tax season. In future years, marketplace enrollment is going to be in the fall only, so it'll be from October 15th to December 7th every year. But because people anticipated that there could be technology challenges, that there could be that people will need to learn the new system and understand the rules and understand their place in the system, that all takes a little bit longer to figure out the first year. And so that's why there's a lengthy open enrollment period. So this creates special opportunities, I think, for people who do tax assistance and other financial assistance in the early part of the year, because you'll be encountering these people at a time where you can still affect their coverage for the year, which means that you can help them avoid penalties and you can help make sure that their premium tax credit is correct and that they're enrolling in coverage that they're entitled to enroll in. Whereas in future years, you may meet people after the window for that decision is already closed. And so I think that there are a couple of points that I know that I will be making to clients in the 2014 filing season. So this coming filing season in preparation for the following year, really. So I would tell people that in 2014, there are new opportunities for health coverage. In Medicaid, they can enroll anytime. But for health insurance that has premium tax credits, there's a limited window for enrollment. That's the open enrollment period that closes March 31st. And I would make sure that I understood how to refer people. If I wasn't going to help them enroll myself, then where can I send them? I'm also going to tell clients that there is a new requirement to have insurance coverage. I have a lot of the same clients come back to me year after year, and the last thing that I want to do or that I want to have happen is for people to come to me the following year and say, but you didn't tell me I needed to get insurance. You didn't tell me there was a new penalty for not having coverage. So I'm going to tell them that this year in hopes that we can figure out a way for them to get coverage or ease their mind if they already have it, and try to avoid some more difficult conversations the following year. So you can see sort of where we are with coverage and sort of how the Affordable Care Act is intended to work. So the blue area shows the current Medicaid and CHIP eligibility for different categories of people. And so previously, everyone has been, dropped in these buckets. And if you didn't fit in a bucket, then you probably didn't have coverage, and that would be childless adults or really adults without dependent children in the home. Often you can see the national average is coverage at 0% of poverty, so they actually have no coverage in most states if you are a childless adult. And then above Medicaid eligibility are the premium tax credits. And actually this slide has some animation, which unfortunately we don't have today, but the intent of the law was to sort of even out Medicaid a little bit and to bring everyone up to 133% of poverty, still leaving those other folks, the children and pregnant women at their current levels, but bringing everyone else up to 133% of poverty. And then above that would be subsidized coverage through the premium tax credits. Now, in some states that haven't expanded coverage, what's going to occur is a coverage gap. So there might be a gap between where Medicaid ends and the premium tax credits begin, because the premium tax credits only start at 100% of the federal poverty level. And so if you are in a state that looks like the state in this slide, which is the national average, and you're a jobless parent, so you have kids but you don't have a job, and your income is at, let's say, 80% of the poverty level, then you're likely going to be too rich for Medicaid but too poor for premium tax credits. And that's because some states have decided not to expand their Medicaid programs. And so it's created this gap. So let's talk a little bit more about eligibility for premium tax credits. It's for people with income between 100 and 400% of poverty, and I have the figures of how that translates into real dollars there. People need to be U.S. citizens or lawfully present. You cannot be eligible for Medicare, Medicaid, or other public coverage, and most employer coverage that that you will have will meet these. You can't be eligible for employer coverage and still get the premium tax credits. There's a test for employer coverage and whether it counts and whether it blocks you from premium tax credits. We're not going to get into that level of detail, but basically your employer coverage needs to meet a certain standard and it needs to be affordable to you. But the affordability test is tricky, and we're not going to have time to go into that today. You also have to file a tax return for the year in which the credit is used. And so people who receive credits for 2014 need to file a tax return for 2014, so filing it in the spring of 2015. People don't need to have filed previous tax returns, and some people were concerned that they needed to file a 2013 return, and that's not true either. And if you're married, you can't file separately. This is another exclusion, just like the earned income credit or education credits or other kinds of credits and deductions that really discriminate against the married filing separately status. This is another one. You can't get the premium tax credits if you're married filing separately. So right now people are going through the complicated and sometimes frustrating process of submitting applications through this marketplace for advanced payment of credits. And what happens in this process is that the marketplace, or rather the applicant estimates their income for 2014. And so the premium tax credits are done based on an estimation of income. And that has to be backed up and sort of verified by what your prior income was. So if you're consistently making $80,000 a year and now you say, oh, no, I'm only making 30, then you would need to sort of justify that. And then based on that estimate and other allowable factors like your age, then the marketplace is going to estimate the amount of advanced payment that you can receive. And that advanced premium tax credit will be sent directly to the insurer on a monthly basis to cover a portion of your premium cost, and then the individual pays the insurer the balance. Some people may not like the advanceable nature of the premium tax credit and may not want to rely on that. And so it is possible to enroll in a marketplace plan and collect a premium tax credit at the end of the year and claim it on your tax return as a refund. And the credit is refundable. The reason that I think that the population of sort of tax preparers and volunteer tax preparers and financial assisters and all of these folks are just really need to understand the Affordable Care Act is because what they've done is they've really made a lot of these terms in the premium tax credit eligibility and even now Medicaid eligibility dependent on tax terms. And so you have a knowledge base that is very, very important in completing and accurately completing one of these applications, whereas people who come at this from a health perspective are a little bit at a loss when you talk about terms like adjusted gross income and who constitutes a household from a tax perspective. So while the application is complicated, it's really areas that people who do tax assistance already know quite well. So just very, very briefly, a household for the purpose of premium tax credits is basically your tax household. So it's individuals that you claim a deduction for on your tax return or expect to claim a deduction for in 2014. So again, this is where the estimation comes into it. And the household doesn't change just because only one person out of 6 on the return needs premium tax credit. So your household is your household. And like I said, it's not based on any previous tax return, and it can change during the year. So you might say, especially in some sort of more complicated families, you might say that your household is 5 people, and then at the end of the year it's 4 people, and you would just need to adjust your premium tax credit throughout the year to make sure that you don't owe money back at the end of the year. And for the premium tax credits, income is really based on your adjusted gross income. And there is a modification for that, so it's a MAGI measure. So it's your adjusted gross income, which is the bottom of the first page of the tax return, plus a couple of add-ins, excluded foreign interest, tax-exempt interest, and this is the big one, non-taxable Social Security benefits. So the Social Security benefits that don't get taxed on a normal return get added into the calculation of MAGI because it's income that's available to the family for healthcare purposes. If we're talking about Medicaid, there are a few additional modifications, but we're not going to go into that a lot today. But you can understand how someone without a tax background, if you ask them their income, you know, they might just go straight to a W-2 wage income. But in fact, you know, if you have any tax background, then you know you're thinking about things like self-employment and rent and IRA distributions and all of those sorts of things. So that's where it's really, really helpful for people to have some sort of background in tax. So this is a little scary, but I'm gonna try to do the 5-minute version of how a premium tax credit is determined. And the reason that I want to talk about this is because the truth is that the computer does a lot of this, but it's important to know why someone's credit might be very high and someone else's credit might be very low. And so it's really just sort of understanding the factors that go into why one person's credit is high and another's is low. So this is the formula. The credit is the cost of a benchmark plan minus the expected contribution. Let's break that down. A benchmark plan is, in marketplace terms, the second lowest cost silver plan as determined by the marketplace. So basically the cost of a benchmark plan is, the benchmark plan is a plan that is not the best plan that you can buy, but it's also not the worst. And so this is pegged as, you know, in this particular tier of plans, it'll be the second lowest cost of that tier. And that is a number that will vary by the individual because it depends on your age and your geography and like a few other factors. And it is something that the marketplace will just tell you what it is. It's not something you'll have to figure out for yourself. And then the expected premium contribution is a percentage of income someone is expected to pay that's based on a sliding scale. And that's a statutory sliding scale. You can see it here. Again, this is a number that a computer spits out. So it's not a number that you need to calculate on your own. So let's just look quickly at the effect of some of this. Let's take our friend John. John is age 24, and his plan cost is $5,000. If he has income of just under $23,000, that will put him at 200% of the federal poverty level. And at 200% of the federal poverty level, the share of income that he would be expected to contribute, what the government considers affordable, is 6.3%. And that number is not magic. That number is just from this graph here on the expected premium contribution. So his is 6.3%, which equals $1,448. And so the difference, his premium credit amount is his benchmark amount, which I gave you as $5,000, minus his expected contribution. And so that means that his premium credit is $3,552. But let's say that John makes more money. Let's put him at 300% of the federal poverty level. In that case, the share of income that he's expected to contribute goes up. So now instead of paying 6.3% of his income, he's expected to pay 9.5% of his income. So the amount that he pays goes up, which means his premium credit goes down to $1,725. So this just illustrates the way that the premium tax credit is not a fixed amount, but it's really a gap filler. It fills up the difference between what you can pay versus how much the premium actually costs for you. And so let's say John's a little older. Let's put John at age 64 and look at what that does for his premium tax credit. So if his income is at the 200% of poverty level amount, then his expected contribution, same as in the last example, is 6.3%. So you can see that his premium credit at age 24 is, again, $3,552. But at age 64, his premium is a lot higher because he's older and because insurance companies can charge up to 3 times as much for people who are age 65 than they can for people who are age 21. And so this really illustrates how the premium tax credit works as a gap filler, again. So John's income hasn't gone up. His income is the same. And so even though his premium costs a lot more, he doesn't have any more ability to pay than he did at age 24. And so the premium tax credit comes in and fills in that gap between what he can pay, which is the $1,448, and what his premium actually costs. And as you can imagine, life changes will affect the eligibility for premium tax credits. So at the beginning of the year, right now, for people who are going to the marketplace now, people are projecting what their income for 2014 will be. But at the end of 2014, when they file the tax return for 2014, we're going to go through this premium tax credit calculation again, but with real income, with their actual 2014 income. And so that is how the actual final tax credit will be calculated. And that means that at tax filing time, if income increases over what the estimate was, people may have to repay a portion of their credit. But if their income is lower than they had expected, then they might actually get more credit. They might get a refund at tax time. And because this is sort of a scary concept of potentially collecting thousands of dollars on advanced premium tax credits, then having to repay a portion of it, there are limits to the amount that people can have to repay. Similarly, there's a verification process at the beginning of the process to make sure that you're not just sort of picking a number out of the blue for your income and getting a premium tax credit based on that. They're going to verify your income based on prior tax returns, based on monthly wage data that they have that the government has through other data sources, based on W-2s and other estimates of income. So there's verification at the beginning, and then there's reconciliation at the end. Changes in family composition are also very important. So birth, adoption, marriage, divorce, separation. Again, you can't file married filing separately and claim a premium tax credit. But people can change the amount of their credit at any point during the year. So if something has happened, they can call the marketplace and say, this thing happened. We had a new baby, or someone lost a job, or someone got a second part-time job or something. And the premium credit can be recalculated to make sure that it's as accurate as possible at the end of the year. And here, just for your reference, is the list of, the chart on repayment. And so you can see that for people who are under 200% of the poverty level, so individuals with income of less than about $23,000, the most that they can repay is $300. If you're at 400% of the poverty level and above, you have to repay every dollar that you got. So people at that end, they're not going to get a lot of premium tax credit anyway, but if they do get it and then they creep over that 400% level, then they would owe it all back. So we'll talk briefly about the penalty for failure to obtain coverage. The penalties are pretty low for 2014, but then they rise pretty quickly over the next couple of years to the maximum penalty in 2016. And there is a penalty for every uninsured person on your tax return. And so it's not just your kids, but it's anyone who's listed as a qualifying relative, for instance. And if the penalty isn't paid, it can be collected out of your current or your future refund. So one thing they're not going to do is according to the law, they're not going to do criminal prosecution, liens or levies on property, but that is going to stand as a as a pending collection on your future refunds. And so it's important that people understand that there is a penalty. And we're not going to talk about this. This is just math. I mean, this is what the what a computer tax program would do. But the annual penalty is the greater of either a flat dollar amount or a percentage of your income. For the flat dollar amount, you can see listed for 2014, an adult would pay $95, and that's an annual number. If they were uninsured for half the year, then they would pay half of $95. So the penalty is assessed on a monthly basis, but these are annual figures just to make it easier. A child, the penalty is half of that of the adult penalty. And you can see that those flat dollar amount penalties grow quite a bit. Or you could pay a percentage of income, and that is 1% of your income above the filing threshold. So again, this is just math that the computer will spit out, which is the greater number. But it's important to know that these penalties get pretty serious, especially in 2016 and beyond. And finally, before we get to questions, there are a lot of grounds for exemptions from the penalty, and it covers a lot of people that I know that I work with. So in particular, there are exemptions that are granted by the marketplace, and there's a big category of hardship with all of these different ways that people can qualify for an exemption from the requirement to have insurance because of hardship. So if people have difficulty paying their bills, if people are in foreclosure or are homeless or what have you. Also, if someone's state has not expanded Medicaid, if they fall into that gap that we talked about, then they're eligible for a hardship exemption. If insurance based on your income is just unaffordable, and unaffordable for this purpose is if insurance costs more than 8% of your income, then that's considered a hardship, and so you need to submit an application that exempts you from the marketplace or from the penalty. Other exemptions are granted through tax filing. So there is an exemption from the penalty that can be granted because your income is below the filing threshold, for instance, or because insurance is unaffordable. Undocumented residents, they also can get an exemption because there's no financial assistance to help them meet the requirements, so there's no requirement. If people have short gaps in coverage, then that's an automatic exemption. So if you're uninsured for less than 3 months, like maybe you have a gap between jobs or something, that's okay, there's no penalty. And then there are a couple of exemptions that can be granted by either the marketplace or the IRS, and those are listed. It's Indian tribe membership, incarceration, or something called a healthcare sharing ministry. Both that and the religious conscience exemption are very, very narrow. These are basically folks who haven't participated in other programs like Social Security, for instance, and so it's a pretty narrow list of people. I wouldn't expect to see that very often. So with that, I think we can go to questions. Here's my contact information.
Great. Thank you so much, Tara. I believe that Nakia gave the link earlier, just real quick, that we will have this presentation, both the recording and your PowerPoint, available on our website by early next week, if not later this week, so everyone will have access to your information as well as your contact information. So a lot of good information, and we do have several questions. So with that, I am going to go over to our Q&A. So the first question comes in: if someone becomes eligible for Medicare due to a disability, could they just stay in their marketplace or non-marketplace plan instead if they choose to and forego Medicare coverage?
No. So if someone becomes eligible for Medicare, then they're no longer eligible for subsidies to buy coverage in the marketplace. It's just one of the exclusions from the subsidy provision. But there is a lengthy delay between the time in order to get disability coverage. And so during that delay, while you're in the waiting period, you can get marketplace coverage and premium tax credits. But once you actually become Medicare eligible, then Medicare is going to be your best option.
Great. Thanks, Tara. I believe you may have answered this one, but just to make sure, if you estimate your 2014 too low, will you have to repay all or part of the subsidy?
If you estimate your 2014 income too low, then that means that you are getting more subsidy than you were entitled to, and you would repay a portion of that subsidy. So, assuming you're under 400% of poverty. So if I said that my subsidy should be, let's just say, my premium tax credit should be $2,400 based on what my income is, $2,400 for the year, $200 a month. And then at the end of the year, it turns out that I actually made more money than I thought, and my premium tax credit was too high. Then I would need to pay back the difference, but capped at the amount on that chart. So it depends on income. The more income you have, then they assume that the more you can pay back. If you're low income, then they assume that you can pay back very little, even if you have overestimated a lot.
Great. So you also mentioned, Tara, limits on out-of-pocket costs. Mm-hmm. So will they be doing this for Medicare as well?
No, unfortunately. It's a huge gap in Medicare in having no limits on out-of-pocket costs, and it's definitely there are a lot of seniors and people with disabilities who feel the pinch, but the law did not get that far. So that's for another day.
Great. We have a question on what are the 10 components of the essential health coverage?
Oh no, I don't have them in front of me. But it is the categories of coverage that you would expect. So it's hospital coverage, physician coverage, prescription drugs, rehabilitative and habilitative services. I think they have pediatric listed as a separate category, radiology, that kind of thing. So it's really a comprehensive set of benefits, and don't be scared by the fact that there are 10 of them. That sounds very, very, very finite, but in fact those are very broad categories, and so it covers, you know, basically what you think should be an insurance that's comprehensive. Great.
If you do have a list, Tara, and if you wanted to send those to us, we could post them.
I'm happy to do that, yeah.
Great. We'll do that then. If someone is on COBRA and discovers they are now eligible for Medicaid, can you enroll right away, or do they have to stay on COBRA until their COBRA expires?
Oh, that's a great question. So if you're on COBRA and you find out you're eligible for Medicaid, you do not have to stay on COBRA. You can go straight to Medicaid. So what the Affordable Care Act does that's some people are going to have trouble adjusting to is we set up these open enrollment periods for private insurance. And so when we say that the open enrollment period lasts from October to the end of March for this season, then what we're saying is that if you come in May and say, I want to buy insurance, then you need to have a special reason that you didn't buy it before. You can't just decide you're going to buy it in May. But Medicaid is not like that, even under the new rules. So Medicaid is always open. If you're eligible, you can move there at any time, and that includes if you're receiving COBRA.
Great. Why does the enrollment form for the marketplace ask, quote unquote, do you have a physical, mental, or emotional health condition that causes limitations in activities like bathing, dressing, daily chores if there are no more pre-existing conditions?
That's a fantastic question. So the reason that it's asking about it's basically a disability question, whether you have a disability that limits your activities. The reason that they ask that is actually not for private insurance, but as a Medicaid screening tool. And so the application is really mostly designed to screen people for income eligibility for Medicaid. But there are a couple of questions like the one that this questioner identified that are supposed to trigger additional disability-based criteria for screening to see if you're eligible for one of the disability categories of Medicaid, which might have different income criteria and which will have better benefits than the expanded Medicaid. So expanded Medicaid will have basic benefits, but it doesn't get things like a lot of the home and community-based care and long-term care and those sorts of things that you can get in Medicaid if you have a disability. And so some of these screening questions, it's not about what you would be charged in the private market, but it's a trigger to see if you might be eligible for Medicaid based on your disability.
Great, thanks so much. And so somewhat related, an individual wants to know what state agency will someone who has an intellectual or developmental disability, who will they be able to go to for assistance in finding insurance, not assuming that they have a professional who can do it for them. For example, if someone has insurance through a job and loses it, will an agency such as DARS, the Disability Rehabilitative Services, be trained on doing this?
I don't know the answer to the last one about training. As far as the state agency, one thing that we're really striving to do, and that a lot of advocates thought was really important, is to try to make the application process for these health insurance programs a one-stop shop. So they call it, so it's called no wrong door. And so people should be able to go to their Medicaid agency, and their application should be able to screen them the whole way through premium tax credits. And so it probably depends by state who is going to be able to do this. But if people if people can determine you eligible for Medicaid or help you with a Medicaid application, then they should also be able to help you with this, because it's one application, and then based on your answers and based on your income and the income verification, then you'd be routed to different doors. So you'll be routed to Medicaid if you're eligible for Medicaid first. And then if you're not eligible for Medicaid, then you're routed to premium tax credits to find out what your premium tax credit could be. So it should be no wrong door. It should be wherever you can start the application, it should lead you to whatever program you're eligible for. But I think that which state agency people can do this will probably vary by your state.
Right. So what would be a reason to choose a non-marketplace plan instead of a marketplace plan? Some insurance companies in my state are offering both, although unfortunately they don't say what state it is. Yeah.
Well, I have to say I don't see a huge reason to choose a non-marketplace plan. So a couple of important points here. So there are going to be some plans that are offered outside of the marketplace, and it's important to know that those are plans that don't have any premium tax credits attached to them. So if someone has income between 100 and 400% of poverty, I honestly can't think of a reason. If they're eligible for premium tax credits, they should be in the marketplace to claim those premium tax credits. If they buy the plan outside of the marketplace, even if it's the same plan, they're not going to get the tax benefit that they would get if they bought it in the marketplace. And just to make things fair, if a company is offering the same plan inside and outside the marketplace, they have to be the same price. And so if it's the same plan, it should be the same price. And so you're not even going to see a premium differential outside in a non-marketplace plan. Some companies have decided not to be a part of the marketplace, and so I'm sure that they are marketing heavily. There are also I'm sure that there's still like some catastrophic coverage that happens outside the marketplace. But really, if people are eligible for premium tax credits, it's very difficult to think of a reason that you would want to forego those in order to, buy similar coverage for more.
And someone else asked, if you become eligible for a marketplace coverage during the year after the open enrollment period, could a person sign up at any time?
Not at any time, but there are special enrollment periods. So you might be familiar with this for, it's usually the case for employer-based coverage too, where if you have a baby, if you move, if you get a new job, then you can sign up for coverage even outside of the open enrollment period. And there are the same kinds of criteria for signing up for a plan in the marketplace outside of open enrollment. So you'd have to meet certain conditions, and then you'd probably have to sign up within 30 or 60 days, depending on the condition. But yes, there's a way, if your circumstances change, there is a way to get into the marketplace outside of open enrollment.
Great. Can a plan change which drugs are covered at any time they want during the plan year?
I believe that is still the case. Yes. I can't think of anything that restricts their ability to do that, unfortunately.
Okay. If someone has gross income below the normal requirements but must file a return because of other rules, for example, the net earnings from self-employment of $400 or more, are they exempt?
Oh gosh, you guys are such tax nerds. I love it. So the answer is yes. So even if you're filing a tax return, like the questioner said, because your income is from self-employment, or maybe because your income is low but you're eligible for the Earned Income Tax Credit, any of those reasons that you file, or maybe just because you want to file because you want to feel like you've checked all the boxes, even if you're not required, then yes, you can still be exempt from the penalty if your income is below the filing threshold. Filing a tax return isn't going to all of a sudden make you pay penalties if you otherwise weren't required to.
Great. So we have another, if you're enrolled in a tribe and the tribe pays your copay, would you be eligible for the premium tax credit?
Oh, that's a really good question. I might have to get back to you on that. I think that the answer has to be yes. Because there are all sorts of special rules though for tribes, but I have to say they all go in favor of people paying less. And so I'm sure that that's not a disqualifier for the premium tax credit.
Great. I'm going to do one or two more and then we'll wrap up. So as a custodial parent, I'd enroll my child with my income numbers. So if the non-custodial parent claims the child, will they have to pay the penalty if their income is higher?
That's a really complicated question. So whoever claims the child, whether it's the custodial parent or a non-custodial parent, whoever is claiming the child on their tax return would pay any penalty that's owed for the child. But if that child has health insurance, then of course there's no penalty. So if the custodial parent has enrolled the child in, let's say, in their job-based coverage or in Medicaid, then the non-custodial parent who claims the child isn't going to owe the penalty. So it's not the fact that that person enrolled the child. It's just does the child have coverage or not, however they got it.
Great.
So I hope that answers the question.
I think so. And what I was going to say also, we have several questions we didn't get to because we were run out of time. But if anyone has, we haven't answered your question, or if you have follow-up questions to the questions that you answered, Tara, then I would encourage everyone to email either myself, and my email address was included in the invite, as well as the registration for questions to follow up on the webinar, and I'll make sure we get those to you. Or you will have access, as we said, to the presentation on our website late this week or early next week, and so individuals can have your contact information. We can also put that in the chat box for everyone to email you directly or myself, and we'll make sure we get those questions answered for everyone who is on.
Yeah, can I say one other thing?
You absolutely can.
I'm so happy to answer questions for folks, and also if anyone is thinking of doing enrollment through their group and needs some extra assistance, we're available for technical assistance. We've been helping out a couple of tax sites that have opened early, and it's been a great experience, and we're getting a lot of great questions from them and helping them with materials for their volunteers and training and all of that. And so if anyone is thinking about doing enrollment, we are more than happy to help you with some tools, and we're going to have some tools on our website that are specifically for tax preparer volunteers and low-income tax sites. And the website, I forgot to put it on the slides, is healthreformbeyondthebasics.org.
Healthreformbeyondthebasics.org. I'll just put that in the chat, and then everyone will have access to it, as well as your email address. And like I said, once again, and I think that you gave a wonderful overview, Tara, and we really appreciate it, because I know that this is one area that is, new, and a lot of individuals are looking for information and trying to figure out how are we going to, navigate the marketplace, and how do we reach out and educate the individuals that we work with on a daily basis. So we really can't thank you enough for presenting today and for being willing to offer additional help afterwards and answer questions. So we really greatly appreciate that. With that, we'll close out, and we'll say that a special thank you to all of our sponsors, specifically the Walmart Foundation, who sponsored today's webinar. If anyone has any questions, please feel free to contact Tara or myself, and we look forward to having everyone on our next webinar. So once again, thank you, Tara. We greatly appreciate it.
Thank you so much.
And we will talk to everyone soon. Have a great day. Thanks.